Hello folks, my name is Sandeep Arora and I have been a cardiac electrophysiologist at Excela Health, Heart, Lung and Vascular Institute for last 10 years with office locations at Westmoreland Hospital and Excela Square at Latrobe. I did my medical school education in New Delhi, India and subsequently did my internal medicine and cardiology fellowship training in Pittsburgh at West Penn Allegheny Health System. After that, I did a specialized cardiac electrophysiology fellowship training at Mayo Clinic Hospital in Arizona. I have been with Excela Health since 2010 and I am currently serving as Director of Cardiac Electrophysiology. Electrophysiology is a specialized field of cardiology that deals with various heart rhythm disorders. And since congestive heart failure and heart rhythm disorders go hand in hand, we are going to talk about new device-based therapies for heart failure patients. So what is heart failure? Before we go there, let's talk about what is not heart failure. Heart failure does not mean that your heart is going to stop beating or it has failed. Heart failure basically means that your heart is not pumping blood efficiently to the rest of the body. This is either because the heart muscles are too weak or damaged, or they are very stiff and therefore blood backs up in the lungs, causing fluid retention and shortness of breath. So what are the different types of heart failure? We broadly classify heart failure in two types. Systolic heart failure, also called heart failure with reduced ejection fraction, when there is weakening of the heart muscles and the heart does not pump enough blood to the rest of the body. And diastolic heart failure or heart failure with preserved ejection fraction, when heart muscles are stiff and heart does not relax properly between the heartbeats, causing fluid buildup. It is important to distinguish between these two types of heart failure since treatment options depend on them. So what is the metric to distinguish these two types? We call this metric left ventricular ejection fraction or just ejection fraction. Ejection fraction is the amount of blood the heart pumps out with each heartbeat of what it receives. This is measured by a test that is essentially an ultrasound of the heart called echocardiography. A normal ejection fraction is anywhere from 50 to 70%. Reduced ejection fraction is defined as anything less than 40%, whereas between 41 to 49% is borderline reduced ejection fraction. So coming back to our definition, systolic heart failure is defined as ejection fraction less than 40%, whereas a patient with diastolic heart failure typically have a normal or near normal ejection fraction of 50% or more. Today we are going to focus primarily on systolic heart failure with reduced ejection fraction. How common is this problem? Heart failure is very common. There are around 24 million patients worldwide with heart failure, of which 6 million are here in US. Also, heart failure is number one cause of hospitalization for patients over 65 years of age. Moreover, there is high mortality rate associated with heart failure. Therefore, it is paramount important that we treat this condition at an early stage to improve both quality of life and longevity. What are the causes of heart failure? It is important to realize that heart failure is actually a syndrome which is a result of various diseases resulting in weakening of the heart muscles. These diseases could be blockages in the heart artery called coronary artery disease, or patients with prior heart attacks, damaged heart valves such as tight or leaky valves, uncontrolled blood pressure, various heart rhythm disorders, especially uncontrolled atrial fibrillation, other diseases such as prior viral infection, excessive alcohol use, or thyroid problems can also cause heart failure. What are the symptoms of heart failures? Some of the common symptoms of heart failures are shortness of breath with activity or while lying down. It can also cause fatigue or weakness, swelling of the ankles and belly area, and in some patients, it can cause persistent cough or wheezing, especially when you are lying down. If someone has rapid weight gain, usually this is because of fluid retention, and this could also be a symptom of heart failure. There are various classes of heart failure based upon severity of the symptoms. Class 1 heart failure is when patients do not feel short of breath with ordinary activity. Class 2 heart failure is when patients feel short of breath with ordinary activities such as walking up the stairs. Class 3 occurs when patients get short of breath with less than ordinary activities such as taking a shower or changing clothes. Class 4 heart failure is the most advanced form of heart failure when a patient is short of breath even at rest. Please note that heart failure cannot be cured in most circumstances but can be treated, and you are the most important piece of puzzle in the treatment. The more you know about heart failure, the better your health can be. Patients with heart failure should restrict their salt and fluid intake. Salt is like a sponge, it retains fluid. They should also engage in healthy diet and regular aerobic exercise. They should weigh themselves daily, and if there is a weight gain of more than 2 pounds a day or more than 5 pounds a week, they should consult their doctor. They should not smoke or drink excessive alcohol, and it is important that they control their blood pressure and any heart rhythm disorders they may have. There are also multiple medications which can help patients with heart failure. There are various classes of these medications, including diuretic therapies such as Lasix or Bumex. These drugs eliminate excessive fluids from the body and improve shortness of breath and swelling. Other drugs include beta blockers therapies such as Coreg and metoprolol, and ACE inhibitors or angiotensin receptor blockers such as lisinopril or losartan. They have been shown to improve heart functions and prolong survival in these patients. There are also some newer classes of drugs such as angiotensin receptor neprilysin inhibitors, commonly called Entresto, or sodium glucose cotransport 2 inhibitors, an example being Farxiga. We commonly prescribe these drugs in combination to help patients with heart failure. Studies have shown that they not only improve symptoms, but they can also make heart muscles stronger over a period of time. We also have medical devices which can help patients with heart failure. These include a biventricular defibrillator and recently improved baroreflex activation therapy or barostim device, and cardiac contractility modulator device such as Optimizer. A biventricular defibrillator is a special combination of a pacemaker and a defibrillator which is implanted by a cardiac electrophysiologist with 3 wires in the heart. One wire for the right upper chamber called right atrium, second wire for the right ventricle, and third wire is in the coronary sinus over left ventricle. The pacemaker portion of this device sends electrical impulses and stimulates both the ventricles simultaneously and synchronize cardiac contraction. It works in the background and over a period of time can make the heart stronger and improve symptoms. So who will benefit from these devices? These are the patients who have low ejection fraction of less than 35% and have at least class 2 or 3 heart failure symptoms. In addition, these patients should also have an electrical disturbance called left bundle branch block to be eligible for this device and to get any benefit from it. Until recently, we did not have many options for patients who were not eligible for biventricular ICD because they did not have a left bundle branch block. However, recently, FDA has approved 2 cardiac devices and have given them breakthrough designation for patients who do not qualify for biventricular ICD, and these devices are called baroreflex activation device called barostim and cardiac contractility modulation device called Optimizer. A barostim device is indicated for patients with a weak heart and left ventricular ejection fraction of less than 35%, but they are not candidate for biventricular ICD. So how does this work? We have baroreceptors which are present on top of carotid arteries, and by stimulating those baroreceptors with a lead implanted on top of the artery, it sends electrical signals to the brain, which then slows down the heart and decreases stress on the heart. Basically, in patients with heart failure, body is going through stress and it produces excessive adrenaline-like hormones which further clamps down the blood vessels, making the heart to work even more and thereby starting a vicious downward spiral. By stimulating these baroreceptors, this neurohormonal activation is broken and the heart slows down and blood vessels dilate. Studies have shown that this can improve quality of life as well as exercise capacity, and in majority of the patients, it can improve their heart failure classification. It is a simple outpatient implant procedure. We make a small incision right over the carotid artery with the help of our vascular surgeon colleague, and after mapping an area over the carotid artery, a lead is placed and sutured in right on top of the artery where baroreceptors are present. Thereafter, we make a small incision right below the clavicle and create a pocket for the device, and finally, we tunnel the lead from the neck incision to the chest incision and connect the lead to the device. Patients are usually observed for 3 to 4 hours and can be discharged after that time. They are followed up with every few weeks, and we can titrate the setting of the device by increasing the amplitude of the signals to the baroreceptors. These devices can last for around 5 years before they need a new battery. Studies have shown that this is a very safe procedure with very small cardiac or neurological risk associated with the procedure. Again, is this good for you? If you have congestive heart failure symptoms and your ejection fraction is less than 35%, and you have class 2 or 3 congestive heart failure symptoms, but you are not eligible for biventricular device, Barostem could be an option for you. In fact, we take great pride in the fact that Excela Health is the first healthcare system in the whole state of Pennsylvania to offer this treatment to our patients. There is another cardiac device which have been shown to improve symptoms by a different mechanism of action, and it is called cardiac contractility modulation device or optimizer. It is a specialized pacemaker where 2 leads are implanted on the right side of the heart, and it delivers high energy cardiac impulses. This increases the contractility of the heart and can make the heart stronger over a period of time. This is what it looks like, and it can be recharged externally by the patient themselves, and it does not need to be replaced. We can also change the setting of the device with a computer programmer. And like Barostem, this device has also been shown to improve heart failure symptoms and functional class and improve quality of life. So who are the patients that would benefit from this? This would be patients who are in normal rhythm and their ejection fraction is somewhere between 25 to 45% and they have class 3 congestive heart failure symptoms. Heart failure is a common cardiac condition and you are not alone. It can be treated and there are well-established proven medical therapies for heart failure. We also have various options in terms of cardiac devices that can improve quality of life and heart failure class in patients who are still symptomatic with medical therapy. At this time, I would like to introduce our nurse navigator, Jennifer Barrick, who will speak more about how we treat patients at Excela Health Heart Failure Clinic.
Hello, I am Jennifer Barrick, the nurse navigator for the Heart Failure Clinic and the Barostem procedure. Today, I would like to talk to you about our heart failure clinic at Excela Health. At our clinic, we can help you manage your heart failure through a comprehensive approach. Additionally, we are an educational resource to lessen or prevent hospital readmission and increase your understanding of heart failure, including the disease process, diet, medications, and symptoms to improve your quality of life. In our outpatient clinic, our board-certified cardiologists have extensive knowledge and expertise in treating heart failure and work with a certified nurse practitioner, a clinical pharmacist, registered nurse navigator, and a patient care technician, all trained in heart failure management and treatment to provide your care. We see patients at the clinic Monday through Friday from 8:30 a.m. till noon and offer afternoon appointments when requested. Our goals for you in our clinic are to treat your symptoms actively, to decrease emergency department visits, and to minimize hospitalizations and readmission. At your appointment, we want you to become an active participant in managing your health, so we review your symptoms and medications, provide education so you fully understand your disease and process, coordinate your care with other departments if needed, including cardiac rehabilitation, home health, dietary, and your preferred pharmacy. And lastly, we keep your primary care doctor and/or cardiologist informed about your clinic visits, which are meant to complement the care they provide, not replace it. When at home, we want you to continue to manage your heart failure by performing daily weights. We recommend for you to weigh yourself before breakfast, write it down, and compare it to yesterday's weight. Take your medications as prescribed. Checking for swelling in your feet, ankles, hands, and stomach. Following a low-sodium diet and fluid restrictions as directed by your doctor. We recommend a 2,000 milligram low-sodium diet. Do not add extra salt to your food. Eat foods naturally low in sodium such as fresh fruits and vegetables, poultry and fish, and read food labels, selecting lower sodium options when grocery shopping, and balancing activity and rest. Knowing your heart failure zones will help to keep you out of the ER or admitted to the hospital. The green zone, or all clear, is your goal. Your symptoms are under control. You have no shortness of breath, no weight gain of more than 2 pounds, no swelling of your feet, ankles, hands, or stomach, and no chest pain. The yellow zone, or caution, is a warning. Call your doctor's office if you have a weight gain of 3 pounds in a day or 5 pounds in 1 week, shortness of breath, swelling of your feet, ankles, hands, or stomach, feeling tired or no energy, dry, hacky cough, new or increased chest pain, feeling uneasy and you know something is not right. It is more difficult for you to breathe when lying down or you're sleeping in a chair. The red zone, or emergency, it is critical. Go to the emergency room or call 911 if you have any of the following: chest pain, confusion or cannot think clearly, struggling to breathe. At the clinic, we like to bring all of this information together and follow the 6 steps to heart failure success. Weigh yourself daily. Take your medications as prescribed. Follow your diet and fluid restrictions. Balance your activity and rest periods. Know when to get help. Keep your follow-up appointment. Thank you for watching this video presentation today. If you or a loved one have been diagnosed with heart failure and are interested in learning more about the Heart Failure Clinic at Excela Health's Heart, Lung, and Vascular Institute, please call us at 724-689-1357 to request an appointment.